So this question came up in the biologics for lupus video, and I think it's worth addressing. I want to make a few points about just like biologics and being used for one disease versus another in general. And at the end, I'll explain why specifically Humira should not be used for lupus. In terms of biologics, they are designed based on what we understand about certain disease processes, and then we study them for those conditions. So for that reason, a lupus biologic isn't really used in rheumatoid arthritis and vice versa, because A, we don't know if it's safe, B, we don't know if it'll work, C, it hasn't been studied. That's why we can't use one for the other. But more importantly, medications like Humira, which is a TNF inhibitor, other examples are Enbrel or Remicade, actually should not be used in lupus patients at all. In fact, they shouldn't also be used if you suspect someone may have lupus or an overlapping lupus type picture, because TNF inhibitors, this particular class of medications, can actually cause drug-induced lupus. And so for that reason, TNF inhibitors are contraindicated, meaning should not be used in a lupus patient. So hopefully that answers the question of why, we can't use certain biologics that are approved for one indication for another disease, and specifically why we can't use Humira for lupus.